Hello everyone, welcome to Pharmacology Further podcast, and we are going to talk about the e-newsletter of December 23. I know 23 has passed and we are looking forward, we are actually living in 24. But let's wave a final bye to 23 with this e-newsletter, which is actually inevitable, unavoidable, and should be there before we begin the story of the e-newsletters of 24. So without any delay, let's get to talk about the Pharmacology Further December 23 e-newsletter in the form of Pharmacology Further podcast. Coming over to the first section, that is pharmacology difficult? We are going to talk about the December FDA approved drugs. In my list, the first one is iptacopan and the brand name is Fabhalta. It was approved on December 5, 2023 for the treatment of paroxysmal nocturnal hemoglobinuria. It is a first-in-class complement factor B, capital B inhibitor, and it is administered via the oral route in the form of the capsules. The second drug on my list is bevacizumab, small tnjn, and the brand name is Afzivi. I repeat, the brand name is Afzivi. It was approved on December 6, 2023 for the treatment of multiple cancers like colorectal cancer, non-small cell lung cancer, glioblastomas, renal cell carcinoma, cervical carcinoma, ovarian cancer, fallopian tube cancer, and primary peritoneal cancer. What is the mechanism? Let's talk about it. It is a vascular endothelial growth factor and it is a biosimilar. You know about biosimilars? If you don't, we'll definitely talk about them someday. Biosimilar to Avastin. And the route of drug administration is via as injection. That is, it can be IV, IM, parenteral route. The next drug on my list is Lovotibeglogene Autotemcel, or we can also call it Autotemcel. The brand name is Lyfgenia. It was approved on December 8, 2023 for the treatment of sickle cell disease, and it is also employed for the treatment of vaso-occlusive events. Now, as far as the mechanism is concerned, it is an autologous hematopoietic stem cell based gene therapy. The route of the drug administration for Lovotibeglogene Autotemcel is parenteral route, and it is administered as suspension for IV use. Coming over to the next drug on my list is eflornithine. The brand name is Ivilfin. It was approved on December 13th, 2023 for the treatment of high-risk neuroblastoma. That is HR, capital HR, neuroblastoma. As far as the mechanism is concerned, it is an ornithine decarboxylase inhibitor and it is administered via the oral route in the form of tablets. Coming over to the next drug. The next drug on my list is immune globulin IV, and the name is a very long one. It is immune globulin IV human small STWK. The brand name for this immunoglobulin is Eliglo. It was approved on December 15th, 2023 for the treatment of primary immunodeficiency syndrome. Now, as far as the characteristic of the drug is concerned, it is 10% immune globulin liquid and it is administered as liquid via the parenteral route as IV injection, that is intravenous injection. Coming over to the next drug on my list, it is birch triterpenes, and the brand name is Wiz. It was approved on December 19th, 2023 for the treatment of epidermolysis bullosa. I'm sure you have heard about this pathology, epidermolysis bullosa. As far as the drug characteristic and the mechanisms are concerned, the drug is a topical birch bark extract. That is, it is derived from the bark of a tree, the birch bark extract, and it is used in the treatment of wounds in adults and pediatric patients. The route of the drug administration is topical in the form of topical gel. Let's talk about the last drug on my list. It is eplontersen, and the brand name is Wainua. It was approved on December 21st, 2023 for the treatment of hereditary transthyretin-mediated amyloid polyneuropathy. We can also abbreviate this as capital A TTR small v dash capital PN. As far as the drug characteristics are concerned, it is a transthyretin-directed antisense oligonucleotide, and the route of the drug administration is parenteral, that is in the form of injection. Let's talk about the subsection under is pharmacology difficult, and the second subsection is after the FDA approved drugs. We generally talk about the latest medical updates. So these are all the updates about medicine and health fields, and the source of these updates is definitely internet, the most reliable and the updated newsletters, journals, websites, etc. So I actually do a lot of research and I refer to a lot of internet sources to get these recent updates about medicine and health. Let's talk about them. The first one is artificial sweeteners. They contain sucralose, that is a kind of artificial sweetener sugar, and these are considered to be genotoxic. I'm talking about only the artificial sweeteners containing sucralose. So they are genotoxic, they tend to damage DNA as per the researchers, and they may also result in colon cancer. So one should be very cautious, and one should always remember excess of everything is not good. The second point under the medical updates I have, as per a study done in 2023 on the Indian individuals, it identified pre-diabetes. And what is pre-diabetes? That is a kind of condition in which the sugar level is much high, though somewhat lower than the actual diabetic condition, but it is still very high. And when you identify pre-diabetes, it helps in preventing the real diabetes type 2. How? Because one can actually adopt to different kind of measures to control the diet and the lifestyle, and thereby improve upon all these things so that one can save oneself from getting into the state of true diabetes. And also one needs to get rid of pre-diabetes. That is also not a favorable state. Let's talk about the next point. One of the researchers, it predicts that risk of alcoholic cirrhosis is very much in people with the habit of binge drinking than drinking daily alcohol in moderate amounts. And if the person is suffering from diabetes or high blood pressure, that adds on to the liver risk. The next point in this subsection, we have studies from Finland Researchers, they suggest that exercise is not solely responsible for the longevity. Rather, good habits like nutritious food, no smoking, good sleep, they also add on to the factors that promote longevity. So one should not only exercise, that is, exercise and also develop good, healthy habits and lifestyle. Let's talk about the next point. The next point is very important and very interesting. Hypnosis. It has been identified by the researchers from the Stanford University to be very effective method aiding in the treatment of psychological disorders, and it can also help in the treatment of some kind of pain disorders. So they have discovered that hypnosis is very valuable kind of a therapy. That's very interesting. Let's talk about the next point. One of the researchers, it predicts a small amount of nighttime light. Many people use night lamp, dim light, and sometimes some people use full-on lights during the sleep. But such kind of any amount of light, even the dim light, it has damaging results on the sleep quality, and it may predispose to high blood pressure, high insulin resistance, and weight gain, diabetes, etc. So it's not advisable that you even put on little light during sleep. That is according to the researchers. Next point, let's talk about it. It has been found dangerous connection between the mobile addiction, resultant use of headphones, high volume of content, and poor auditory health, and damage to the inner ear, finally leading to a lot of hearing problems. Well, that's the problem of today's youth and even the adult population. We can save the children from this, but very difficult to cure such problems in the adult addicted population. So one should be very cautious about all these things. Since you have knowledge, you can always prevent the dangerous outcomes. We'll come to the third subsection of Is Pharmacology Difficult? And that is From My Classroom. Today we have a very interesting topic to talk about from my classroom. Now, what is this section all about? First, I'll let you know about it. Here I will be sharing some insights of pharmacology learnings from either of the classes that I have taken this month, or about the topics and the chapters that I have read in the subject throughout the month. So today, my own reading topic, it comprises of a drug that brand name is Meftal-Spaz, and I will talk about the current status of this drug today that I have read. So it's quite interesting and very informative. So pay attention to this. Now I want to talk about Meftal-Spaz. Indian Pharmacopoeia Commission, that is capital IPC. The Indian Pharmacopoeia Commission has warned against the use of Meftal-Spaz. Now Meftal-Spaz is a brand name. I'll tell you what is the real drug in the Meftal-Spaz. So it has been warned by IPC for the use of Meftal-Spaz medicine. Now first of all, let us know what is Meftal-Spaz. It's a combination medicine containing mefenamic acid and dicyclomine. Since being the students of pharmacology, you might be knowing about mefenamic acid, that is a kind of non-steroidal anti-inflammatory drug, that is NSAIDs, and dicyclomine. Now, this is a famous painkiller medicine used for the menstrual cramps, inflammation, and rheumatoid arthritis. Now, what is important that we should need to know about it is the mefenamic acid. The mefenamic acid content can actually elevate the symptoms of eosinophilia and systemic symptoms altogether. These are referred to as the DRESS syndrome. Capital D-R-E-S-S. DRESS syndrome. Now, what is DRESS syndrome? Let's elaborate this abbreviated term. Now, DRESS stands for drug reaction with eosinophilia and systemic symptoms. So, you can abbreviate this whole term, drug reaction with eosinophilia and systemic symptoms, as DRESS, D-R-E-S-S, capital. What are the main complications? The main complications, they are skin rash, fever, swelling, organ involvement, and eosinophilia. The government has cautioned to closely monitor the drug use and stay in watch for any of the above stated adverse drug reactions. But you see, there can be certain kind of solutions. Physicians, if they take proper patient history and they also take into account the individual patient characters and monitor the drug use, then they can actually help avoid such complications. Why I'm saying that? Because this is a very rare adverse drug reaction or ADR, and it has also sometimes been reported with the use of paracetamol and ibuprofen, which are the other NSAIDs. So it's a rare ADR, not a very common thing, and it can be actually taken care of if proper patient history is taken and individual patient characters are taken into account. That was all about the Is Pharmacology Difficult big section. Let's move on to our next section, Radgin Wiz. Now under Radgin Wiz, from the Radgin Wiz writing desk, what news do I have for you? Well, Ranjo and the Reckless Course of the Air Flight, my current book was released both as ebook, paperback and hardcover format. It is available at Amazon. It is available at other platforms. I should tell you that story is in the Japanese setting and it's a great adventure book. My next aim is all about in the new year 24. First and foremost, I want to complete the second edition of my old book, Is Pharmacology Difficult, Book 1. And then there will be many new projects to talk about all the year long. So I'll keep you busy with all my new projects in updated form in the upcoming newsletters. That's all in the section Radgin Wiz. Coming over to the next section, Simple and Sparkling. Here we talk about nutrition. So, winters are going on and the days are none but the carrot days. Yes, I know we all are having carrots in winters. So winters, they are marked by special veggies and fruits, and carrots, they are definitely the best things available in the season. Now carrot has versatile uses and it has many benefits. The carrot, the Latin name is Docus carota. These are root veggies. They are available in many colors. The purple variety has polyacetylenes. The yellow one is rich in lutein. Orange carrots, they contain most of the alpha and beta carotenes. And the black ones, they are rich in phenolic compounds. The red variety contains the maximum amount of lycopene. So there are so many coloring compounds which are found in different colors of carrots. Now, if you choose to eat the carrots as raw, then you will get more of vitamin C and you will also get the benefit of its lower glycemic index. Yes, raw carrots have a very low glycemic index. But if you choose to eat the cooked carrots, they are rich in anti-inflammatory and antioxidant qualities. You should know that why carrots are so beneficial. They promote the health vision. They balance the blood sugar. They help in maintaining weight. They improve the immunity. They boost the brain power. They reduce the risk of cancer and heart diseases. They are very, very rich in biotin, vitamin A, B6, vitamin K1, and also they are rich in potassium. So, carrot with multiple colors and multiple benefits. That's all in the simple and sparkling section. Moving on to our last section of the day, Off the Cuff Talks. So in Off the Cuff Talks, we talk about some really interesting topics which are of great value and develop the great personality traits and also help in developing great habits. Today I'm going to talk about meditation. So meditation is simply marvelous. Developing a daily meditation habit is actually a great way to remold yourself into a dynamic, peaceful, and energetic being. Even if it is done for 10 minutes, it can induce transformation. It trains the brain to stay in the present times and maintain awareness and focus for a long period on a certain task or talk. So what you can do and how you can develop such a habit: keep a fixed separate place and go for a fixed time of the day. Now it helps you to get rid of clogged thought yarn and create space and comfort in the mind. In a way, it releases tension, anxiety, and worry. If you follow the meditative habits, your routine and approach becomes more balanced and peaceful. It helps to make you more creative. It develops patience. It helps by lowering the resting heart rate and the resting blood pressure. So it has health benefits also. Other benefits of daily meditation are: it improves the sleep duration and quality. So I would simply advise you all to try meditation for a few minutes daily and see the difference yourself. Well, that's all from my end, and it is the time to announce the final year wrap and bye to 23. I hope to meet you all in the next episode of Pharmacology Further podcast in 24. Happy new beginnings. Happy new year 24. Thank you. Take care. Bye-bye.